Hi, I'm Dr. Jay Varma, and welcome to Thermometer. On this channel, I discuss outbreaks of infectious diseases and give you expert insights on public health here in the United States and around the world. And this is our weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases with my friend and colleague, Dr. Jon Epstein, a veterinarian virologist and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Thanks for having me, Jay. How you doing today?
I'm doing well. There's been a
Yeah,
bit of a flurry of news over the past couple of
a
weeks, and
lot
I
of
have
news.
a feeling that this is, well, it's a combination of a couple of things, right? It's winter virus season, but I also think, with the US government shutdown and then the reopening, there was kind of a
Yes.
backlog of infectious diseases and public health events to talk about.
It's so good to see data coming back to websites, to feel like there are people back at their stations again who really wanted to be doing this work, but weren't allowed to. So it's welcome news to have a big chunk of federal public health up and running again.
Yeah, and only you and I would appreciate welcome news about events that scare the crap out of most
Well,
people.
it's the opposite of no news is good news. In this case, no news was terrifying. So it's good to,
Yeah, absolutely, and I think it's because, you and I are experts in this field, and I'm sure the same applies to people who are experts in other areas of, other sectors where, actually the more you know, the better prepared you are. And, for those of us who work in public health, we want to know about all the dangers out there. It doesn't actually make us fearful about life. To me, it certainly feels like it empowers me.
yeah, it's the greatest truism about public health is that if you don't have eyes on the problems, you just get caught blindsided, caught by surprise, and you're so much worse off. And so one of the greatest things we've done is set up surveillance systems to allow us to pay attention to things like seasonal flu, which we're going to talk about in a little bit, or these periodic episodic outbreaks that happen, but collectively we learn a lot from them. So by being able to pay attention, by having reliable data, it puts us at such a better position when we confront these emergencies.
Yeah, absolutely. And the first story we're going to talk about today is one that is of particular concern to parents and particularly terrifying as well. So, health officials across the country are investigating a large multi-state outbreak of a disease called infant botulism. As of November 14th, 2025, a total of 23 infants have developed infant botulism, and it's all due to a contaminated formula called ByHeart whole nutrition. And it's been reported now in 13 states. As part of the investigation, it was found that all of the infants who got infant botulism had drank this specific formula, ByHeart infant formula. And on November 8th, the California Department of Health found the bacteria that causes infant botulism in an open container of the formula, really kind of sealing the case and making us understand and believe that, in fact, this is the cause of the outbreak and now leading to a nationwide recall.
Yeah, Jay, we talk a lot on the show about foodborne illness, contamination, food recalls, and the importance of monitoring. And infants and young children are just an entirely separate category because of how vulnerable they are to gut infections. And so when you talk particularly about infants and contamination in infant formula, it's worrying. And I know this is rare and we're talking about it because it's important, but not because, it's incredibly frequent, but this is a serious one.
Yeah, and let me give the viewers a little bit of background, and also just to point people to, I've also made a separate explainer video about this because it's a bit of an
Mhm.
unusual disease. But basically, botulism, it is a disease that is caused by a bacteria called Clostridium botulinum, which is found throughout nature. You can find it in soil, you can find it in dust. And under very unique circumstances, this bacteria can produce a devastating toxin. Well, that toxin is particularly useful if you want to protect yourself against wrinkles. It is, in fact, the
Right.
toxin that's used in Botox. But if you get it by eating it, that is not very helpful. You basically can get paralyzed from head to toe. And that's why this is such a severe disease.
Yeah, it's the bacteria creates a neurotoxin, and what it does is it blocks the receptors that are responsible for nerve conduction, electrical impulse conduction in the muscles, right? And in
Yeah,
blocking
and
that,
that's what paralyzes you and prevents you
yeah,
from breathing because, your diaphragm is one of your biggest muscles that helps you with breathing as well too.
really scary.
Yeah, and I think one of the things that's also important for people to understand is there are basically two different types of botulism. So the botulism that most of us know about, or most people know about it, is the one where like the spores of this bacteria have somehow entered a food, and that food often something that's canned because it has to be what's called anaerobic. There's no oxygen entering that can,
Right.
basically produces the toxin, and then people eat, and then very soon after eating, they've basically eaten the toxin, and that's how they get very sick with this illness. And we treat that with a very specific type of antitoxin that is only held and released by CDC. Well, this disease called infant botulism actually involves not eating the toxin, but actually eating these spores, these little, particles that you can find in dust and in soil. And then because the baby's gut isn't fully developed, they don't have the same microbiome that an adult does, those spores are able to then, develop inside the baby's gut and then release the toxin. And as a result, they actually need a very different type of treatment, interestingly enough, called botulism immune globulin, that's only produced actually by the California State Department of Health. And
Hmm.
so these kids all got treated with this special type of antitoxin that's used particularly for infants.
That's really interesting and amazing that that's even available. And California produces it for the whole country. Is that right? If needed.
Yeah, it's one of these interesting things. And in this day and age, you and I have been talking a lot about the dismantling of the federal public health infrastructure. And one of the things that you and I and many other people who are involved in health have been discussing is, can you replace some of these federal government functions with state entities or multi-state collaborations? And this is just an example of where, California has one of the strongest health departments in the country. Well before this outbreak, California has been a leader in actually, this disease called infant botulism ever since I started at CDC in 2001 and used to carry literally called something called the bot pager to deal with this. We used to actually rely on California. So it's just an example of the fact that we do have a lot of states around the country that are effectively mini CDCs, and if they're given the resources to do it, I don't think they can step up and replace CDC, but they can at least help reduce some of the damage that comes with a politicized and defunded CDC.
Yeah, and again, it's worth stating that infant botulism is a pretty rare disease. We have around 100 cases maximum annually in the country, and so that's a great example of where a state can be really impactful. It's a small number of cases, but they're serious, and so we have the resources to produce things at this level by individual states. And what the source of contamination? I mean, factories that make infant formula are very careful. They have to be as sterile as possible. Which is probably why this doesn't happen more often. But do we know exactly how the bacterial spores get into the formula?
It's an excellent question, John, and I don't know the answer. I am sure this is, top of what FDA is working on right now,
Mm,
despite all the budget cuts. Obviously, if there's one thing that galvanizes public attention, it's, seriously ill children at risk of
yes.
death. And so I don't know the answer to that. I mean, I would, let the viewers out there also know that, one of the reasons, mothers and fathers are told not to give their infants honey when they're babies is for the exact same reason, because honey also can contain these spores. Again, they're found throughout the environment.
Right.
And so, by the same way in which formula can potentially get contaminated somewhere in the environment,
Hmm.
into the formula itself, honey similarly can carry these spores. And it's one of the reasons we make sure not to give kids honey until after the age of 1.
That's right. Yeah.
So, John, you and I, talk a lot about rare and exotic diseases.
Hmm.
Infant botulism is obviously getting a lot of attention. Hopefully this will be out of the news soon, and then we can prevent these types of formula outbreaks from happening in the future. But there is a viral hemorrhagic fever outbreak, one that we would not necessarily expect to have seen in the region that we're seeing it. And I'm talking specifically about Ethiopia, a country that I lived in for 3 years. So we just found out that Ethiopia confirmed its first ever outbreak of Marburg virus disease on the 14th of November. And as of today, there have been 9 cases identified in the Omo region, which is in southern Ethiopia near the border with South Sudan. And there's already been a genetic analysis of this Marburg virus strain, showing that it was this strain that has previously been reported in other Eastern African countries, but never before in Ethiopia. It turns out that Ethiopia has never had an outbreak, as far as I
Mhm.
know of a viral hemorrhagic fever. And the last Marburg virus outbreak in Africa occurred in the fall of 2024 when it was in Rwanda. So, John, this is an area that you're an expert on. So, give us some context both about Marburg virus disease and about this outbreak occurring in Ethiopia, a place it's never occurred before.
Yeah, and this one requires a lot of context because it is interesting to see an outbreak in a new geographic area. But when you think about where these viruses come from, it's maybe not so surprising. So we'll start with that. So Marburg virus is in a family of viruses called filoviruses, which includes Ebola. So these are two categories of viruses that cause severe hemorrhagic fever disease with high fatality rates. On average, around 50%, can be as high as 90%. And Marburg and Ebola cause similar types of diseases, and we've known about these viruses for decades, and yet we still see these sporadic outbreaks popping up in different parts of Africa. We know actually a little bit more about Marburg than we do Ebola, interestingly, and we know that Marburg virus is carried by a species of fruit-eating bat called the Egyptian rosette bat, or
So it
Rosetta.
always comes back to bats,
It
doesn't it, John?
always comes back to bats. Well, it's it's so interesting, and why I say it's not necessarily surprising to see outbreaks in new places of Africa where they haven't been reported is two reasons, Jay. One, Rosettas bats that carry Marburg virus have a huge home range. These bats are commonly found across the continent into the Middle East. Okay. And so they cover an enormous amount of Africa, and they are the bats that naturally normally carry Marburg virus. And of the outbreaks we've studied the most, outbreaks from Uganda, for the last 10, 20 years, we have seen that these bats carry and shed this virus. People get infected when they go into environments where these bats live, and these fruit bats live in caves and mines. So we
Yep.
have seen people get infected by going into mines inhabited by these bats and presumably breathing in air with droplets of excreta from the bats, urine and saliva droplets that have virus in it. We have seen people get infected going into caves that have huge colonies, and these bats live by the hundreds of thousands, Jay, massive colonies. So
Inside caves, there are hundreds of
inside
thousands of
caves,
bats. Yeah.
and
Wow.
mines. They will
Yeah.
move
Well,
into, yeah,
and I'll interrupt you really quickly, John. You and I have talked before about my fear of bats, and one of it has to do with, well, I mean, it has to do with me hearing about outbreaks of Marburg virus from people exploring caves. And when I was living overseas with my family, we would go on a lot of fun trips to out of the way locations, and for some reason there was always like a cave visit thrown in there somehow. And
yeah.
I always thought about those outbreaks of Marburg and caves, and that is where a lot of these outbreaks that have been reported in the
It
past have been
is, Jay.
associated.
It is.
Yeah.
And caving is a major recreational pursuit. There's a whole science around speleology. So people go into caves. And I think this is another instance where we've known bats live in caves forever. This is not a surprise. And it's just now about recognizing that there are additional biohazards for going into a cave environment that maybe we didn't used to worry about so much, but they are potentially there. There are bats that carry coronaviruses who live in caves throughout Asia, the horseshoe bats. And so Rosettas, and what's interesting about Rosettas as a small aside is that they are one of the only fruit bats that echolocates. Mostly bats that eat insects are the ones that use sonar to hunt. And because these fruit bats have evolved to live in dark environments, they have a different form of sonar that they use to navigate their way through the cave, more for just moving around and roosting. And then when they get out into the open, they find fruiting trees and blossoming trees to eat fruit and nectar. So it's really interesting. But yes, they are the carrier of Marburg. And in this part of Ethiopia, in particular, the Omo region down south, it is an area where there is one of the largest cave systems in all of Africa. Yes.
Ah, okay. I didn't know that. I never traveled down there while I was living in Ethiopia. Mostly
Yeah.
because there just wasn't a lot of like tourist sites to see necessarily and things.
It's
So
becoming increasingly popular, but the Sof Omar cave system is considered perhaps the biggest, if not one of the biggest cave systems. It's almost 10 miles long. These
wow.
massive subterranean caverns, multiple different bat species live in there, and it's on the list of becoming a World Heritage Site. I don't know if it has, crossed that threshold yet, but it's certainly a treasure, a natural treasure, and more people are going in there. So we don't know yet if these cases had any exposure to those caves or other caves, but it is certainly a possible way that someone in Ethiopia might get exposed to Rosetta bats and Marburg virus.
Do you think there's anything about it being along the border with Sudan that's of interest? I mean, we know obviously there's tremendous unrest and violence and in fact genocide in Sudan. I haven't looked geographically at the map to see if that is one of the regions that's impacted. I don't think it is, but I was just curious if you've looked at that at all too as
Yeah,
well.
I think Jay will have to learn more about the 9 cases and what their travel history is. Are they from Ethiopia? Were they out in that region, working or or undertaking kind of ecotourism? These are all things that'll help us understand. There are also mining activities in the Omo region, so it's
Mhm.
also possible that these people were working in mines and maybe got exposed that way. So there's certainly more to learn. And what has happened, what typically happens, and I'll take the Rwanda Marburg outbreak for example. And actually, there was an outbreak in Uganda for the first time in 2023. And I was involved in the investigation of that outbreak to understand how people are getting exposed. And so, generally, the follow up is after cases are identified and they get into treatment centers, hopefully, they're well enough to be interviewed and we understand what their work history is, their travel history, where they live, and what their environment is like. And there may be, then a team that gets sent out to the area where the people might have been exposed to look at the environment. Are there caves and mines around? Are there people who, participate in mining or entering into caves and get a little bit more background that way? So this is the kind of information that'll help us understand how this outbreak might have started.
Okay, that's great, John. So let's go through a couple of just some basic facts for the viewers and listeners out there. First of all, if you get Marburg virus infection, the signs and symptoms are kind of what we expect with a lot of these viral hemorrhagic fevers, right? You get fever, you get body aches, you can get abdominal symptoms like nausea and vomiting, but they're very nonspecific, right? They don't really point you in any one particular direction.
That's right. One of the things that's characteristic is a skin rash. You get petechiation from the hemorrhaging and bleeding, so you can get red spots or blotches on your skin that can be indicative of a viral hemorrhagic fever.
And there is no treatment and there is no vaccine, unlike with Ebola virus. Is that
Well,
correct?
that's right. So important distinction here. There is vaccine for Ebola. There are vaccines for Ebola that are being deployed. I think we've talked about the DRC outbreak that is now on its tail end, probably about to be declared over. We don't yet have a vaccine for Marburg. And I know that there are many people working on it. And so probably we will have one at some point, but not currently.
Yes, exactly. And this is one of the reasons it's particularly fearsome, right? I mean, I think that again, just like Ebola virus disease, these are not outbreaks that tend to cause, worldwide pandemics because they require close physical contact with somebody who tends to be severely ill. So, though it has a very high fatality rate, from a public health epidemiologic perspective,
Hmm.
it is something that's going to be devastating to the people that come into contact with these cases, whether they live in the home, whether you're a healthcare worker that takes care of them. But these don't tend to be the diseases that we think about as likely to cause hundreds of thousands or millions of cases necessarily.
No, that's true. And I think, the biggest outbreak we really have seen so far was the Ebola outbreak in West Africa back in 2014,
Yeah.
which reached about 22,000 cases. And you're right, it's due to close contact, but that happened to occur in an area that was on the border of 3 different countries and people made their way to urban centers. So far, these Marburg outbreaks have been more contained, smaller. And you're right, Jay, we worry about healthcare workers, we worry about family members that might take care of people once they're infected. The treatment here is supportive care, right? You get people isolated when they're sick, you get them on fluids, you try to get them through the infection, let their body get through the infection process and get through the disease, keep them hydrated. And then importantly, just keep them apart from anyone else because they're infectious while they're symptomatic.
Yeah, and we know that just good quality medical care, in hospital medical care can help a huge number of people survive, and a lot of these very high fatality rates that we know about from Ebola, but we also know about Marburg. A lot of it has to do with the fact that there just isn't high quality intensive care available,
Mhm.
because again, your body can, in many situations, survive this infection as long as you are getting respiratory support in case have infection that spreads or inflammation that develops in your lungs, a fluid support because it's difficult to both take in fluids, but you can also have problems with managing your blood pressure and your circulatory system. managing the risk of secondary infections that can occur because your immune system is overwhelmed by this, and you're obviously also in a healthcare facility as well. And then managing the hemorrhage that can occur through the replacement of blood products or clotting factors as needed. But that's the type of intensive care support that's often only available either in a very advanced urban center
Hmm.
in developing countries, or in an intensive care unit in a highly industrialized place like North America or Europe or East Asia.
What's interesting about Ethiopia, and you know this well from having lived there, is not only is there, a fairly good public health infrastructure, but it's also the headquarters of the Africa CDC. So there's an incredible basis, at least for support for getting teams together, for WHO coming in, and for deploying experts out to the area where this outbreak occurred, right?
Yeah, there is. And then that is great in terms of identifying the cause of this outbreak and potentially interrupting transmission. I will say that unfortunately, Ethiopia does not have, very good intensive care unit capacity. There are a
Mm.
number of highly trained intensive care physicians in Ethiopia, but the availability of a high quality ICUs is far less limited. So while you do have some incredibly well educated and well trained professionals, there just aren't the resources. And I know this very well from having investigated the sort of healthcare system capacity when, during the early spread of COVID-19, and we were trying to assess, ventilator capacity and other things like that. So I do hope, obviously that, these patients that have been infected, those who are incubating the virus, can get the high quality medical care that's needed. But we're going to obviously be following this outbreak closely
Yeah.
to see how it evolves, and hope it certainly doesn't spread to other parts of Ethiopia, major urban centers, or other countries in East Africa.
That's right, Jay. And I think what it's going to really prompt forward is an analysis. We've seen outbreaks now in Rwanda, in Ghana, now Ethiopia, is starting to look at why we're seeing more spillover of Marburg virus from rosettes bats. We know that Egyptian rosette bats are the reservoir, so this is very well understood. But what are the activities people are doing that are putting them at risk, and what kind of safety measures can we now put in place across the region, across the continent even, where we know that the reservoir exists, the virus exists, and if we know that mining activities or intensive caving for one reason or another, tourism, if we know that's taking place, then it's really important that we start putting systems in place to protect people who go into those environments or
Yep.
avoid it altogether.
Absolutely. Okay. And now for our last topic that we're going to discuss, also related to, humans interacting with animals, potentially
Hmm.
in ways that are risky. There's a worrisome case of bird flu here in the United States. And the reason it's worrisome is it's not the same strain of bird flu that you and I have been discussing throughout 2025. So the Washington State Department of Health has identified a human case of what we call highly pathogenic avian influenza in a resident of Grays Harbor County. And it was reported on the November 13th. And this marks the first human case reported in the United States in 9 months, with the last case being reporting all the way back in February 2025. But what's really worrisome about this case is that it's a strain of bird flu known as influenza A H5N5. So not H5N1, but H5N5, and marking the first known human case ever associated with this virus. So, John, what do we need to know about H5N5 and this case in particular?
Jay, chalk this up to the discussions that we've been having over the past year about an increased incidence of spillover of bird flu viruses into mammals, and then the worry about them getting into people, particularly with H5N1. H5N5 H5N5 we've known about as a bird virus. As you said, we haven't seen it in people before. We have, though, Jay, seen it get into terrestrial mammals. And just about a year and a half ago, there were cases in Canada that were observed of mammals, foxes, raccoons, skunks getting infected with avian influenza H5N5 that was carried over by migratory birds from Europe. And in almost all instances, those animals got very sick and nearly all of them died. And so we know that this is a bird flu virus that is able to get into mammals and cause disease, although that study found that it wasn't yet well adapted to transmission among mammals, which was a good thing.
Yeah, and I think in this situation, this is an older adult who presented the hospital with a high fever, confusion, respiratory distress, and it took a little while for them to identify this as a novel flu strain.
Hmm.
And the Washington State Department of Health is the one leading the investigation. and they released a statement saying that this affected person has a mixed backyard flock of domestic poultry at home. And those poultry also had exposure to wild birds. So it is believed that either it was the domestic poultry that this person had in their backyard, or contact with wild birds, or some combination that led to this type of virus exposure.
Yeah.
But it gets to this issue that you and I have been talking about, which is even if H5N1 doesn't itself evolve into a strain that causes a pandemic, when you have so many different species being infected with flu strains, there is a lot of promiscuity between these viruses, right? And the risk of evolution into a strain that can cause severe human illness that has sustained from one person to another.
Yeah, we've known for a long time that flus are one of the most rapidly evolving viruses because of their ability to reassort or swap genes. When an individual animal is infected with two different strains of flu or two different types of flu, it can swap genes, and that's when you get these new flu viruses or new types or subtypes created. So here we have another instance of a historically known as a bird only version of flu, influenza A virus H5N5, having the opportunity to get into domestic birds. And that is how people tend to get exposed to bird flu viruses, by handling sick poultry, or now in the United States, dairy cattle. And we're seeing a resurgence of H5N1 virus in both poultry and cattle now, Jay, as we get into the migratory bird season, where more and more birds are coming through the United States on their southern migration.
Yeah, and as you and I have talked about, it's incredibly difficult to predict, what the future of avian influenza is here in the United States and around the world. But there are no good signs, and I think you and I'll just to reiterate something that we've talked about to people who have been following us for a while. What also is really worrisome is we just don't know how much of the absence of reporting actually represents an absence of disease when it comes to human health cases. We know that so many of the people that come into contact with poultry and dairy cattle in the United States are migrant workers. We know that this tremendous crackdown that's been going on in terms of immigration enforcement is going to drive them underground. It's going to lower the interest of those people as well as their employers to actually have any type of testing or any type of government surveillance reporting. And we know that a lot of the public health staffing has been cut as well too. So in a way, I'm happy to hear about this case, because it makes me believe that in fact there is ongoing attention and surveillance being paid to this. But it also is notable that this was not a mild case. This is a severe case. And it's not the severe cases that I'm worried about missing, but the severe cases in Washington State. You've got great healthcare infrastructure. You're going to have smart clinicians who are going to test and try to find the cause of disease. But it's those milder cases, the ones that eventually lead to sustained transmission, that I would also like to see reported. And I would like to see them reported because it would reassure me that
Right.
somebody's watching. Right.
Well, no, all these are amazing points. And I think we started at the top of the show talking about how important surveillance is. And our surveillance system for flu is really designed to pick up on novel flus, meaning that, as people report to hospitals and they get diagnosed with just influenza A virus, we have surveillance, sentinel surveillance sites around the country, hospitals that will characterize positive flu samples. And this was a surprise, Jay, to H5N5. I mean, we've seen a limited number of H5N1 cases, I think about 70 or so to date. A lot of those, in fact, most of those have been mild. I think there's been one hospitalization or one, child death from the H5N1 infections, but this was one case and it's severe. And this is consistent with what we saw in animals and even in experimental ferret models that are infected with H5N5, severe disease, high mortality. So your point is a good one. We don't want to miss mild cases. We don't even know if there are any mild cases with H5N5 yet, because this is so new to us.
Yeah. Okay. Well, we're going to keep an eye on this. And with that, we're going to wrap up this week's episode. To everybody out there who's watching, if you're interested in public health, if you like being aware of the risks that are out there and also ways that you can keep yourself healthy, please hit the like button. Please subscribe. Please ask us questions in the comment section. All those things help us with the algorithm to make sure that, more people get information about things that are going on in the world that impact your health. And we'll see you back here next week for another episode of Inside Outbreaks.
And Jay, I just want to point out, because we tend to keep things brisk in our conversations, and it's really us trying to distill this information for people and contextualize it. But you've been spending some time doing some really good explainers on your website. And I just wanted to mention that there's an opportunity to learn more about avian influenza surveillance, infant botulism, all these things that we're talking about, take a bit of a deeper dive with you. And so I would encourage people also to check those out to get a little bit more background about the medical conditions.
Yep, absolutely. I'm going to be sort of increasing the number of those because I tend to get a lot of questions from friends, family member, colleagues, and things like that. And I found that this can be an easy way to get some useful information out there to people. So please keep watching this channel for all sorts of potentially useful content, and we'll see you back again soon.
All right. Take care. Be well.
Bye-bye.